Hi, I'm Dr. Crute and I'm a board certified dermatologist, and I wanted to go over a few key things to look for when you're doing your self-skin examinations and examining your moles to check for changes. The easiest way to remember these are with the mnemonic A, B, C, D, and E's. So these are helpful hints for different changes or different characteristics to look for in your moles. So A stands for asymmetry. Each half of a mole should look pretty identical to the other half. If there's one part of a mole that looks drastically different from the rest of it, that could be a sign that there's something abnormal or unusual going on. B stands for borders. Most moles should have fairly smooth, well-defined borders. So if you find any spots that have jagged or irregular borders, that could be a concerning feature. C stands for color. Moles should be fairly uniform in their color and some variation of skin color to brown. So if you see variations in color where there's multiple colors throughout a mole, or if you see changes in that color over time, so if it's getting darker, changing to multiple different colors, or if any part of it includes kind of red, white, or even blue, those are possibly concerning features to bring up with your dermatologist. D stands for diameter. So most moles are 6 millimeters or less, which is roughly the size of a pencil eraser. So if you notice a spot that is either new or changing that is larger than that size, it's probably best to have that checked out to see if there's anything worrisome going on. And E stands for evolution, which just means change over time. So you know your skin best. If you see a spot and something catches your attention that you think it has gotten larger, darker, or has changed, that's definitely a clue that something could be going on with it. The other thing is if any moles are causing symptoms, so itching, stinging, burning, bleeding, scabbing and not healing, those are all things that are potentially red flags when it comes to moles. So when you're doing your self-skin examinations, the mnemonic to keep in mind when you're checking your moles is A, B, C, D, E.